All right, can I get your name?
Luis.
Sorry?
Luis.
Luis?
Luis.
All right. And I heard a little story that you folks went down to the hospital for your son and ended up with a $800 bill.
$877.
Really? So what was wrong? What happened? Can you tell a little bit of the story?
Well, we went to the hospital because my son had 4 or 5 days high fever, cough and chest pain, and before the hospital we went to the 2 or 3 walk-in clinics. They refused to attend him, and they want to charge us $80 for the medical assistance. And the nurse told us maybe it's much better if you go to the hospital in 2 more days. Just give him Tylenol, and we say okay. And after 2 days, my son was worse, and we went to the hospital. They attend him very, very well. Check all the chest, X-rays. But after 3 days, fortunately, my son wasn't with a pneumonia or a bad disease. But after 3 days, we received an invoice for $877, and that's too bad for us.
Yeah.
We can't afford that amount.
Now, basically, they said that it was only for emergencies that it can be used.
Yeah.
Now, did you know whether this was an emergency or not?
No, because we are not a doctor, and we don't know what is the real emergency for them. Because the lady told us if you have a heart attack or if it was pneumonia, probably it's covered, probably no.
Mm-hmm.
And we say, oh my God, when we're going to know what is the real emergency or not.
You've never diagnosed pneumonia before yourself, have you?
Yeah. I'm not a doctor. I can't go to the mirror by myself and say, open your mouth. Okay, it's a pneumonia. I can do that. Even I can go to the pharmacy and prescribe myself an antibiotic or any drug for my son or for myself.
Yeah, you're not a doctor.
No.
Yeah.
And they say that just for the public risk is going to cover. Public risk, but there's a very bad disease like tuberculosis, Ebola, HIV. And we said, well, and what happened with the normal disease that we have in many times of the year, like throat infection or like stomach infection or urine infection, I don't know what kind of infection, that we need to go to the doctor. And what happened with the Canadians or the normal citizens that we are on the bus, in the schools and the jobs, and if I don't attend them for a doctor, I'm going to contagious all those people.
Yeah, back to you're not a doctor and you wouldn't know whether there's any of your family has a really, really bad contagious disease.
Yes. Before that, sorry for say that, but before that, this stupid rule, this stupid new law, we have all the basic human rights things that we need to have.
Yeah, and
because we are not illegal in Canada.
No, and this was just a new law that was enacted by Jason Kenney on June
13th.
13th.
Yeah. And before June 30th, we are covered for everything.
Yeah, and you've been in Canada for 3 years now?
For 3 years. Yeah.
And you never had any problems before?
We don't have any problems.